Hi dear doctors, welcome to 𝗧𝗵𝗵𝗵. Myself Dr. 𝗲𝗵𝗵𝗵 and the topic of discussion for today's class is going to be extremely important topic. I feel all the topics which I am teaching are actually extremely important one way or the other, but this important topic is very important when somebody's child is going to come. See, you might become a pediatrician ahead, you might not become a pediatrician, but what is important is that any patient for you should be able to take care, at least primarily, because you are an MBBS graduate, right? So let's quickly start with this topic, keeping in this mind that a tiny child is coming to my OPD and telling, "Sir," I said yes. Of course, child can't speak, but the mother can speak. I'm asking the mother, what happened? Mother will say, "Sir, I'm totally shattered." I say, "What happened?" She'll say, "You know what?" I say, "What?" My child. What happened to your child?" "See my child." What happened?" "See, my child is having a colicky pain, doctor. What should I do?" I'll ask, "Madam, don't worry." So, colicky pain. What does this colicky pain means? Colicky pain means that there is excessive unexplained cry, infant less than 3 months, and you can suspect a colicky pain. So you can expect a colicky pain if there is an excessive unexplained cry in infant less than 3 months. Now the hint is that it is more commonly seen in the evenings, because in the morning the baby is going to take the feed, and in evening the baby is going to start crying like anything. Okay, so evening crying. Okay, so I'll ask the mother, "Yes sir, is your child crying in the evening so much?" "Yes sir." "Okay, then it can be what? It can be a colicky pain." Okay, the mother will say, "Sir, how can you be so sure that it's a colicky pain?" I'll tell mother, "See, if the child is crying for more than 3 hours per day, if the child is crying more than 3 days in a week, and if the child is crying for more than 3 weeks in a month, this is a diagnosis of colicky pain." 3 colicky. How to remember? C for colicky. C is the third alphabet, so rule of 3. If the child is crying for more than 3 hours in one day, if the child is crying for more than 3 days in 1 week, if the child is crying for more than 3 weeks in 1 month, this is a diagnosis of colicky pain. "Oh my God, doctor, what can happen to my child? Why my child is behaving like this?" Don't worry. The child can have gastroesophageal reflux. Gastroesophageal reflux. The child might be underfed. The child might be overfed. The child might be having some allergy to the milk protein. The child might have gastric issues or gas, or might be having an immature gut function. So either the child is having what? Esophageal reflux. Either the child is overfed, either the child is underfed, either the child is having allergy, and of course the child can have gas also. Mother, Goa is the cause. G for gastroesophageal, O for overfeeding, A for allergy, G for gas. And from overfeeding you can remember underfeeding also. Okay. Yes doctor, I know that my child is doing a cry which is totally inconsolable, but do you think my child is in pain? Yes, of course, I think your child is in pain. Why? Because the infant is drawing up the legs. If you have seen the people who are having immense pain in stomach, in abdomen, they are going to just take up their legs. Okay. Mother says, "Doctor, I need a surety. I said, "Okay, fine. It's okay. I'll give you the surety. Tell me, mother, if your child is hungry, have you not fed?" "No, doctor, I have fed properly." "If your child had a fall?" No, doctor, what are you talking?" Okay. "If your child is having fever, to rule out the infection?" No, nothing. So if there is nothing, it's just a colicky pain. So reassure the mother, rule out the underlying cause. Okay. And last but not the least, the most important thing you have to understand that that you have to comfort the child, and of course some pain management can be done. Okay, so the only treatment of this is going to be what? Is going to be pain management. Okay, pain management. And of course the management has to be done like Like for example, if you are thinking that the child is overfed, underfed, you have to give the treatment as a feed. Okay, you have to give a hypoallergic formulas if you think there is an allergy which is going to happen. Okay, food allergy is going to happen. Of course, if the child you think is having the the gas issues or something, okay, let me tell you, if the child is having gas and GERD, what to do. So we have got some enzymes. Okay, we have got some enzymes, so we are going to give those enzymes only to the baby, like pepsin, trypsin, okay, 𝗖𝗵𝗵𝗴𝗍. This will help the baby to digest the food or digest the milk properly, and once the digestion is proper, the child is going to be the child is going to be all right. So this is about a story, a cute story of a child who is having a colicky pain. So thank you so much for watching. We will see you in the next class. Thank you.